most important factor that contributes towards the aging. And that is why I say that I would love to do the structural rejuvenation or reconstruction. Because if I have got this normal thing and we get an aging thing, see what happens. This thing has gone up. The bone below the orbital margin, below the brow, has gone up. So your brow looks as if it is dropped. Over here, there is a reabsorption. See the distance between the inferior orbital foramen and the margin. See this distance, it has reduced. So you want to build up this thing. So these are the structural sort of reconstructions. So what happens over the period of time from the age of 20 to 70s, your face get decreased volume in male by 70 mLs. That means 70 injections. And in females, it's about 61 filler injections before you can get the same volume of the bone that we have lost. Now, this is a significant loss of the volume. And what we are trying to do, we are trying to create that thing with 4, 5, 6 mLs. So we need to know strategically where these mLs should be placed. Look at that, the height of the midface. It is reduced by about 4 millimeter, which is about 10% in male, and about 3 millimeter, which is 6% in females. So we do not really need to write this young and old. We know that this is a young skull and this is the old one because of, see, the reabsorption of the bones and the height. Now, when we talk about the nerves, there are two muscles, which are procerus muscle and corrugator muscle. With the time, they become hyperactive as opposed to all the other muscles, which go proportionally hypotonic as opposed to one muscle, which is zygomaticus major muscles. It goes significantly low activity, reduced activity. So that is where a Fami technique, where you inject the fat in the muscle, will rejuvenate that muscle and improve the skin. I'm not talking about the filler, I'm talking about the fat, or even you can inject this nano fat in that muscle in order to rejuvenate that muscle. So if you know your anatomy, you know the problem, you can actually address that thing. Coming to the facial layers, of course, the periorbital, the oral, periorbital, all these things are important. But the fat from this scrapes, it can go towards regions. They are the same thing. It's just that one is more dehydrated. So you want to rebuild this layer number 4, which is which is like a space for the fat. So you want to put some volume over there. That's the concept behind it. And then you need to understand what are the fat compartments over there. Now, these areas will actually, if these atrophic fat will do certain changes: temporal hollowness, brow displacement, inferior orbital aging, which is increase in the eyelid cheek junction, the cheek hollowing, the melafat thing, nasolabial deepening, marionette lines, jowl appearance, and all those things happen. Now, coming to the ligaments, which basically, as of today, has got no role to play, but there are certain ligaments, or there is a ligamentous line which we need to keep in mind. And that is, if you see from below to above, you will see that this is mandibular ligament, right? So there is a mandibular ligament over here. We go above there, it is zygomatic ligament. Then we go over there, this is lateral orbital thickening. And above all, it is temporal ligamentous adhesion. So if we see in this, which is on the left side of your screen, you can see how this goes in one plane. So anything lateral to this plane moves up and down. Anything medial to this plane does not move up and down because you have got certain things come here. For example, from here to mid face, and I'm going to show you in a minute, you have got this eye, and between this mid face and the lower face, you have got this mouth. So the true retaining ligaments are there, and then there are false retaining ligaments. The true retaining ligaments are between the bone and the skin, and the false retaining ligaments are between the fascia and the skin. So now look at this. We have got this area. Now, if we go, this is, let's say, you have got a facial nerve right over there. You have got this thickening, which is a temporal thickening. If you go below the temporal thickening, you will see this area, which is the lateral orbital ligaments sort of thing. Below this orbital ligament, you will see that there is the zygomatic and then the mandibular, and they go in one line. Now, if I lift the skin over here, or this fat layer, which is the layer number 2, right, or 3, right? So what happens is that this is the deep temporal fascia. This is over here. This is all the superficial temporal fascia, and with the SMAS layer, this is the fat, this is the skin, and actually this fat is more or less like a SMAS layer as well, right? Because what happens is that the fat layer is subcutaneous layer is really thin at this time. Anything anterior to this will be volumized. Anything behind this ligamentous will slide on each other. So there are 3 layers over there: the skin, subcutaneous tissue, and the SMAS layer. So if I inject into this temple over here, it will have an impact over here, and if I inject something over here, it will not have an impact over there because there is an eye over there. So when I inject over here in this temple area, I can actually lift it because you can see this movement. This is the SMAS layer, and all of them are in continuity. But when I inject over here, I can volumize that thing, but it will have no impact over here, just like we are doing.